This medication is commonly used to treat acne by reducing the number and severity of acne pimples and promoting quick healing of pimples that do develop. Tretinoin belongs to a class of medications called retinoids, and it works by affecting the growth of skin cells. It is important to follow the dosage instructions provided by your healthcare provider, and it is typically applied once daily in the evening. It is best to apply this medication to clean, dry skin, and to avoid applying it to areas around the eyes, lips, and mucous membranes. It is important to use sunscreen and wear protective clothing while using this medication, as it may increase your skin sensitivity to sunlight. Before you start using Tretin-X combination package, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. When applying this medication, be sure to wash your hands first. Clean the affected skin with a mild or soapless cleanser, and then pat it dry. Use your fingertips to apply a small amount of the medication in a thin layer, usually once daily at bedtime as directed by your doctor. Some preparations may require you to wait 20 to 30 minutes after cleaning your face before applying the medication, so be sure to consult the label directions or your pharmacist if you have any questions. Remember to only use this medication on the skin and avoid applying it to certain areas such as the inner lip area, inside the nose/mouth, cut, scraped, sunburned, or eczema-affected skin. If the medication gets into your eyes, make sure to flush with large amounts of water and call your doctor if eye irritation develops. Also, remember to wash your hands after using the medication to avoid accidentally getting it in your eyes. It's important to note that during the first few weeks of using Tretinoin, your acne might appear worse because the medication is working on pimples forming inside the skin. It may take up to 8 to 12 weeks to notice results from this medication. To get the most benefit from Tretin-X combination package, use it regularly at the same time each day. Avoid using a larger amount or using it more often than recommended, as it will not improve your skin any faster and may increase the risk of developing redness, peeling, and pain. This medication is available in different strengths and forms, such as gel, cream, or solution. The best type for you to use will depend on the condition of your skin and your response to therapy. Be sure to tell your doctor if your condition lasts or gets worse. After applying the Tretin-X combination package, you may feel warmth or stinging on your skin. You might also experience redness, dryness, itching, scaling, mild burning, or worsening of acne during the first 2 to 4 weeks. However, these effects usually decrease with continued use. If you have very dry skin, using a daytime moisturizer may be helpful. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist immediately. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. However, if you notice blistering/crusting of the skin, severe burning/swelling, or skin discoloration, it's crucial to contact your doctor right away. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed above, it's important to contact your doctor or pharmacist. If you experience any side effects in the U.S., you can report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Tretinoin, make sure to inform your doctor or pharmacist if you have any allergies, especially to vitamin A-related drugs or other retinoids. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Before using this medication, inform your doctor or pharmacist about your medical history, especially if you have eczema. Tretinoin may increase your skin sensitivity to the sun, so it's important to limit your time in the sun and avoid tanning booths and sun lamps. Weather extremes like wind or cold may also irritate the skin, so it's recommended to use sunscreen daily and wear protective clothing when outdoors. If you get sunburned or experience skin blisters/redness, make sure to inform your doctor before using Tretinoin again. While using this product, it's best to avoid electrolysis, waxing, and chemical depilatories for hair removal on the treated areas. If you have recently used products containing sulfur, resorcinol, or salicylic acid, it's important to use Tretinoin with caution and wait until the effects of such products on the skin have decreased before using Tretinoin. During pregnancy, Tretinoin should only be used when clearly needed, as it may harm an unborn baby. It is also unknown if this drug passes into breast milk, so make sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. And remember, don't start, stop, or change the dosage of any medicines without your doctor's approval. When using Tretin-X combination package, it's best to avoid other skin products that are harsh, irritating, or drying on the treated area. This includes hair perming solutions, alcohol/lime/menthol containing products, medicated or abrasive soaps or cleansers, and products with a strong drying effect. Additionally, products containing benzoyl peroxide can be very irritating and may decrease the effectiveness of Tretinoin if applied at the same time. It's always best to talk with your doctor or pharmacist about the safe use of prescription and non-prescription benzoyl peroxide products. If this medication is accidentally swallowed, it can be harmful and may cause serious symptoms such as passing out or difficulty breathing. In case of an overdose, it is important to seek immediate medical assistance by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It is important to keep this medication out of reach of children and pets to avoid accidental ingestion. When using Tretin-X combination package, it's important to remember not to share this medication with others. You can still use cosmetics, but make sure to thoroughly clean your skin before applying the medication. Be cautious, as some cosmetics and soaps may make your acne worse. However, moisturizers are generally safe to use. When purchasing cosmetics, moisturizers, or other skin care products, look for labels that say non-comedogenic or non-acnogenic. These products are unlikely to exacerbate your acne. If you're unsure, ask your doctor or pharmacist which products are safe to use. It's also important to note that acne is not caused by dirt, so avoid cleaning your skin too often or too vigorously, as this can irritate your skin and make your acne worse. If you forget to use the Tretin-X combination package, use it as soon as you remember if it's the same day. If you don't remember until morning, wait until your next dose is scheduled. Now let's talk about how to properly store Tretin-X combination package. It's important to keep it at room temperature and away from heat and fire sources, as the gel preparations are flammable. Also, make sure to keep it out of reach of children and pets. When it's expired or no longer needed, be sure to properly discard it by consulting your pharmacist or local waste disposal company. And remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.